Sure. The CALLIPER trial is a phase 2 trial, so a proof of concept trial in progressive MS. And the treatment under study is vidofludimus calcium. This is a second generation DHODH inhibitor, so similar to teriflunomide, but it's a second generation in that it lacks the off-target kinase effects that teriflunomide has, and so appears from previous trials to have less side effects like hair loss and liver enzyme irritation. It also works on a couple different pathways that may be relevant for active inflammation in MS and progression in MS. So this phase 2 trial is enrolling patients with both primary progressive MS and secondary progressive MS. And amongst the secondary progressive patients, both those with active inflammation and those without active or non-active inflammation, secondary progressive patients. And patients are being randomized to vidofludimus calcium or placebo and are followed over time. The primary outcome, as typical for phase 2 progressive MS trials, is whole brain atrophy. Now, an interim analysis was planned to just kind of get some sense, to get an idea of the activity of vidofludimus calcium in these patients. And so partway through the trial, this was a pre-planned interim analysis to just get a sense of what direction things were heading and to ensure that things were going as expected. And the outcome for this interim analysis was neurofilament light from the blood. And what we found in this interim analysis is that neurofilament across the whole patient population was decreased a little more than 20%, so 22% in the vidofludimus treated patients compared to placebo. When we looked at a breakdown of the subgroups of patients, the patients with active inflammation, the active secondary progressive patients, they had a little more than a 40% reduction, so a 43% reduction in neurofilament in this interim analysis. And the patients with primary progressive MS or non-active secondary progressive MS, they had 19 to 20% reduction in neurofilament with active treatment. So consistent results of reduction in neurofilament in the vidofludimus calcium patients compared to placebo. Now this is just an interim analysis and it's a fluid biomarker neurofilament, so we await the full trial results to really know how this therapy may be working in progressive MS. So the trial is ongoing and we're hoping for results sometime in the next 1 to 2 years. Now, an important caveat is that we don't know the predictability of serum neurofilament in progressive MS, particularly with regards to this outcome of the trial, which is whole brain atrophy. So we're not totally sure if this interim analysis will strongly predict, but it's at least going in a favorable direction and so is encouraging.